Good afternoon, Claudine. How are you today?
I'm good. How are you?
I'm fantastic. For those watching, my name is Robert Burns, and I'm our Thompson Communications Specialist. I'm here today with Claudine Durkee, who is our Director of TFCO at Thompson. Is that right?
That's correct. You got it.
Okay, fantastic. So, what we wanted to do today, Claudine, was really just have a conversation a little bit about TFCO and, who best than to talk to besides you, right?
I appreciate it. I love to talk TFCO, so thank you.
Sure. One of the first things that I wanted to kind of get an understanding of is TFCO and foster care. Here at Thompson, we have two different programs that are similar and they do similar things. And maybe some of even the clientele may be similar, but of course there are differences, and I know you know those. So can you tell me a little bit about TFCO in general, and then maybe some things that make TFCO different than traditional foster care?
Absolutely. So TFCO actually stands for Treatment Foster Care Oregon. It's an evidence-based practice. And what that means is it's just been heavily researched and it's proven to show positive results. Um, I personally like to think of TFCO as I like to think of it as a bridge between mental health services and traditional foster care. So our program, we utilize well-trained, well-supported foster parents, and we create a treatment home for our teens um, to come into and to use as a bridge to come back into the community.
Hmm.
Um, so we place our teens into these treatment homes and we shower them with intensive therapy for about 6 to 9 months. We also do intensive therapy with their families that they're going to return to,
Hmm.
so that by the time they graduate from us, those families are better equipped to welcome them back into the home. So um, our focus is really more on the treatment side of things and less on the foster care side of things, if that makes
Okay.
sense.
Yes, that does make sense to me. And a couple things that stood. I always like to point these out. When you
Mhm.
mentioned being a bridge, being a bridge, that's a big thing. And then of course the difference between, the traditional foster care that's not so focused on treatment, and then again the treatment care foster Oregon, that's the in the name almost. So the
Yeah.
treatment piece of it, the therapeutic piece of it, that's really what seems to be different. Is that right?
That's right. I really think that's what makes us special. I think it's what makes us more successful in a lot of ways. And what I really think is incredibly different about TFCO is that we don't just look at treatment for the teenager, we look at treatment for the family that they're returning to as well.
Hmm. That makes a lot of sense. So the family that they're returning to, I mean, just to even to look at that part, I mean, because you got to think like this child, this family unit that they're coming from, there may be some situations there, whether they may be traumatic or they just may not be in ideal type situations, that there's a need for treatment. So it's not
Yeah.
just that we're giving treatment, there's a need for this treatment. This treatment is being, it's thoughtfully applied, and it's, being received by someone and by this family unit. And then this child is being prepared for entry into the, I mean, is that a correct understanding?
Yeah, that's a great understanding of it. And I think, anyone who's been a parent or anyone who's been around kids recognizes that um, some kids need a different parenting style than all the other kids that you've ever had or been around, right? And so we try to recognize that and we try to push in those skills that maybe don't come naturally to certain parents.
Mhm. So that's a very good baseline understanding for me, and I'm sure for everybody else watching. So, how new is TFCO with Thompson?
Well, very new, actually. We're still in kind of we've got a foot in the implementation stage and we have a foot in being operational. So we're really looking for families that want to open their homes and become treatment foster parents for us. The more the merrier. It's going to make us a more robust program. But TFCO itself has been around for a number of years, and it's been implemented here in the United States, but also internationally. But what I think is really unique about this program is Thompson is the only provider of TFCO in North Carolina. It's really the only provider in the South of this program. And we're currently building 6 regional teams around the state, and that will make us the largest TFCO program in the U.S.
I'm really glad that you said that. We should definitely have you talk about TFCO because there's so much that you just said there. So like to break that down, so TFCO is not a new model. This is a proven model that's been around for quite some time. That's actually shown national, it's been proven nationally. And so Thompson is bringing that here. And from what you just mentioned, I mean, we're the only one in the Southeast that's doing that. So that's pretty much my understanding. And I think that's what makes us different because I'm sure there are a lot of other companies and organizations that do foster care, but how many of them have TFCO? And now we know the difference between the two.
Right.
So let's talk about it like this. Look at it from another lens. And there may be people out there who they have these thoughts that maybe come from a certain place about foster care. We could look at them maybe as misconceptions.
Yeah.
What common misconceptions do you see? I mean, I know you probably see them and you address them on a day-to-day basis. So, and your staff as well. What do you see from a misconception standpoint?
I think the biggest misconception is that the teen population is too hard to foster, right? They're too aggressive, they're too moody, they're too defiant, Um, but I think in TFCO, what I like to tell people is we really carefully select our youth that come into the program, and we vet our youth to our foster homes. And what I mean by that is we're not a heads and beds program, right? We don't just place a youth in a home because that home has an opening. We look at the characteristics of the teenager, we look at the characteristics of the home, and we really make sure that they match. So for example, if we had a very introverted, shy teenager who had social anxiety, we wouldn't
Mhm.
place them in a home that's super active in their community, always has somewhere to go, multiple commitments, because it wouldn't be a good fit for that family, and it wouldn't be a good fit for the
Mhm.
teenager, right? So um, we really want to make sure that we get that part of it right.
I love
Um,
that example. I love that example, Claudine. I had done quite a bit of research, and I think I wrote one of the press releases a long time ago on TFCO, but I didn't realize that. Like you said, I mean, matching the teen to the home, that's something that I'm sure probably does address the common misconceptions. And as we're talking, if there's any other misconceptions that are common, please feel free to shout them out. In the meantime, I wanted to maybe change gears a bit
sure.
from maybe let's pretend that we're a parent who's considering the TFCO program and they're wondering like, what if I'm a first-time foster parent? Like, how will I be helped? How will I become ready? That sort of thing. Like, what should they know?
Yeah, no, that's a great question. Um, they should know that our program is time limited. So youth are going to be in their home only for 6 to 9 months, and then they're going to go back with their family. While the youth is in their home, they are going to be very well supported, both the teenager and the foster parent. So the foster parent has 24/7 access to their TFCO staff. We consider them part of our clinical team. So we're calling them every day to ask them, what behaviors are you seeing in the home? What's your stress level? What do we need to address tomorrow? Um, and because we acknowledge the job that they're doing, we pay them a higher daily rate. So they get $100 a day um, because we recognize we can't do the work without them,
Hmm.
right?
Hmm.
In terms of getting started, it's as simple as reaching out to us. We have a link on Thompson's website that they can go to. Press the link, they're going to go right to our page. Um, there is a application process that they'd have to go through. They need to receive the state mandated training that all foster parents have to go through. And then in addition to that, we do TFCO specific training with them because we want them to understand how the model works, how to use the behavioral program in their home that we utilize, how to support
Hmm.
positive behaviors, all of those things. Um, We also have them attend a weekly group with other TFCO foster parents so that they can
Cool.
talk about what's going on in their home with other parents. And we push in trainings to those meetings if the parents say they need it and want it.
Wow. So, I mean, and you've said so much. I just want to kind of break it down a little bit
Yeah.
because we may have a first time person listening right now. They're like, okay,
Yeah.
this sounds great. It sounds like a lot. So let's break it down. You said that first of all, it's from a it's a temporary thing. So the program you said I think is 6 to 9 months. Was that correct?
That's correct. Yeah.
So it's relatively temporary, and for those who are engaging with this, it's a great way to make a strong impact on a teen. Like, you know, that this, if this is your first time, it may be a good fit for it to be a 6 to 9 month piece.
Yeah.
The other thing that I heard from you is that there are a lot of resources that Thompson, as well as the state, are providing, and so you don't feel like, even if it's your first time, that you're not going to, be led and guided, maybe had your hand held a little bit by Thompson as you get adjusted to this period, because it's an adjustment, isn't it?
Absolutely, it's an adjustment. You're bringing, um, in essence, you're bringing a stranger into your home, right? But we try very hard to make sure that it's a good fit. We help you with that adjustment. We help the teen with that adjustment, and we are with you every step of the way. And I cannot emphasize enough, and I say this as a past foster parent for traditional foster care. Um, our foster parents have 24/7 access to our staff.
Yeah.
So,
Yeah.
it's 10 o'clock at night and you're scratching your head and thinking, I don't know what to do in this situation. You can pick up the phone and you can talk to the treatment staff that you're familiar with, and they're going to walk you through it.
Yeah, Claudine, I think that's a really good piece. I mean, you've given us such a great primer on the TFCO program. Thank you for everything that you do.
Yeah.
One of the things that you mentioned was that like how available the staff is. I think the next thing we may try to have a conversation with maybe one of the staff members. I'm sure they'll be able to give a little bit of guidance and share a little bit more detail about the program. But in the meantime, I just wanted to ask you, is there anything that maybe I didn't cover about this program that, you feel like you wanted to add, or I don't want to leave anything out?
Yeah, no, I guess what I just want to say is, if people are interested, it doesn't hurt to reach out and call us or to fill out the application. Um, you're not signing a contract. So if you decide it's not for you, it's not for you. And we can either get you in touch with some of our other foster care programs at Thompson, or, just say thank you for your interest. But I really think the more people dig into this program, the more they'll realize this is a great way to be supported if you want to bring a teen into your home.
Yeah, I totally agree. Thank you so much for your time,
Yeah.
Claudine. Yeah, I look forward to people watching this and kind of learning more, and you've just shared so much with us. Thank you very much, and we'll talk soon, okay?
Thank you. I appreciate it.
Talk to you, Claudine. Bye.
Talk to you.